think there's a number of different levels of behavioral economics. There's incentives aimed towards patients, so whether it's lowering co-pays for high-value therapies that are underutilized, or whether it's enrolling them in managed care, or rather in disease management type programs in which they actually have different types of supports in place to actually get them using things. And behavioral economics can really be targeted towards physicians too. Pay for performance, while not very effective because the incentives are very small relative for fee-for-service, there's other ways to implement physician incentives to really get them prescribing the high-value therapies that aren't being used. So health insurance, in order to redesign it to influence change in behavior, you have to know whose behavior you want to change and what behaviors, which means being able to identify people with diabetes, in the case of diabetes, and then being able to target different incentives to get them to use things that save lives, cholesterol-lowering medications like statins. And one of the most common ones that's being spoken about now is value-based insurance design, which, as you know, arose at the University of Michigan. And there's been more and more uptake of value-based insurance design type programs. However, really, value-based insurance design is the type of incentive that should be embedded within other patient incentives, all aimed to get them to use those therapies, which help reduce long-term complications and costs.